Iulia Arif. She's the director at the local American working group, and she tells us about the Innovation Hub platform. So we are very curious about this.
Thank you, Professor. Today I represent both the local American Working Group Association and also the Health Innovation Hub in Romania. And I would like to start by acknowledging the value added of this event that has managed to bring us together to discuss about transforming cancer care and to put into public debate this important topic. Cancer is the second cause of death in the European Union, but also 40% of the cancer cases are treatable, which gives us a good reason to implement the European cancer plan and to bring it to our countries. And Romania is one of the countries that has delivered in transposing this European cancer plan into the national regulations through its own program to combat and control cancer. And I'd like to just mention a few of the positive aspects that have derived from a holistic approach on healthcare policies in Romania in oncology. It's the increased prevention through vaccination and awareness on environmental factors that impact patients and generate and have a direct impact on cancer. It's also the for example, screening programs, the newly introduced early access protocols that we are waiting to see in place. It's also fostering environment for access to innovation and clinical trials. So there is an entire ecosystem that generates and supports change, and part of this ecosystem, to circle back to your question, is a public-private partnership that we call the Health Innovation Hub in Romania. The hub was established at the end of 2022 under the strategic coordination of the Ministry of Health in Romania, and having as founding members the 6 leading universities of medicine and pharmacy in Romania, and also the Association Local American Working Group. Since then, several partners have joined the hub, starting with the patients' organizations, the Oncology Society, CROs, pharma companies, and we are hoping to see many more partners who are willing to have an active contribution join the hub. The hub is a national platform aiming to connect research in Romania to international research and development and innovation, aiming also to accelerate certain areas of the health system that works also in synergy with the national health strategy in Romania. This also has a great impact on oncology as well. And 2 of the pillars that have been working since the hub was launched are clinical trials, building a competitive and functional model for clinical trials in Romania, and also education and prevention on NCDs. For the clinical trials pillar, just to get into a bit more detail, this year Romania has launched its first national strategic plan on clinical trials with the support of and implication of over 50 stakeholders. Many of them have been present here today. And through this strategy, we aim to work together to determine a more friendly environment for clinical trials that would benefit the patients, the health system, and also the Romanian economy. And the second pillar, dedicated to education and prevention on non-communicable chronic diseases. It's a pillar addressed also to partnerships, both private and public entities that can join together and propose these types of programs and campaigns with the regional and national impact. And some of these projects will kick off at the beginning of next year. So just to, as a takeaway, I believe that the focus and the energy should be on the entire pathway and journey of the patient, with the support of all the stakeholders involved, because we are all here together to work on increasing patients' life expectancy and the quality of life for both Romanian patients and patients in Europe in general. Thank you.
Thank you very much, Iulia. And it's a really nice example, again, of an organization trying to support initiatives by this network. So I suppose there are also other working groups in other countries?
Indeed,
like this?
We are part of a larger network of working groups. Some of them are...
American working group, or is this...
Yes, American, formed by American companies or companies that have investments in the US as well. We are all connected through a network in Europe and connected to the organization Pharma in the US. And we all support innovation and access to innovative medicines and biotech, and a faster and a more accelerated development of the health systems.
Yes, and I think this is also something to think about on how to capitalize on these opportunities to launch projects, often with local communities, with companies, with public organizations and citizens. So that's really interesting. So this also exists, and you can work on improvement of cancer care. So that's thank you very much for this good example.